the classification of antineoplastic drugs. First on the list is alkylating agents. These are drugs which alkylate or donate an alkyl group to other molecules by covalent bonds. They also alkylate DNA, RNA, and various enzymes and their interstand cross-linking of DNA. For the actions of alkylating agents exert cytotoxic effects, immunosuppressant effects, and radiomimetic effects. For cytotoxic effects, alkylating agents destroy the rapidly multiplying cells, both cancer and normal cells. Second, immunosuppressant effects. Alkylating agents are good immunosuppressants for which they are used in rheumatoid arthritis and other autoimmune disorders. And lastly, radiomimetic effects. Action on DNA resembles that of radiotherapy. For the MOA, on administration, these agents form highly reactive derivatives like carbanion ions, which transfer alkyl group to various cellular constituents, particularly to DNA, like sulfhydryl, amino, hydroxyl, carboxyl, amine, and phosphate groups, and bind them with phosphate bonds. Alkylation of DNA also leads to miscoding and cross-linking between DNA strands. And the net result is interference with DNA transcription and replication, breaking of DNA strands, and ultimately cell death. Resistance include the following: increased ability to repair DNA lesions, decreased permeability to the drug, and increased production of glutathione or glutathione S transferase, which catalyze the conjugation of drug to glutathione. For the side effects of alkylating agent, we have here depression of bone marrow, suppression of gonadal function, nausea and vomiting, some degree of GI toxicity, and also reversible hair loss and mutagenicity, or the induction of permanent transmissible changes in the amount or structure of the genetic material of cells or organisms. I have here examples of alkylating agent, and first on the list is the nitrogen mustard. Nitrogen mustard is limitedly used in combination with other agents for Hodgkin's disease and also for non-Hodgkin's lymphoma, lymphoreticular neoplasia, pleural and peritoneal effusions, and mast cell tumor. It is extremely short duration of action since it undergoes rapid chemical transformation in water or body fluids. It is a severe vesicant, hence should be given carefully through IV. GI toxicity is prominent unlike other alkylating agents. Examples of nitrogen mustard are mechlorethamine, cyclophosphamide, melphalan, uracil, mustard, and chlorambucil. Second example for alkylating agents is the alkyl sulfonates. It is widely used as alkylating agents due to their excellent leaving group ability. And the example for this is busulfan, which is used in myeloid leukemia, and the specific adverse effect is pulmonary fibrosis. Third example for alkylating agents is the nitrosoureas. They act by the process of alkylation to inhibit DNA repair, and it crosses the blood-brain barrier and are used to treat brain tumors. Examples are carmustine, lomustine, semustine, and streptozotocin. Fourth example is triazine. They are usually made by the action of a Grignard or alkylithium reagent on an alkyl azide. Examples is the carbazine. For the fifth example, I have here methylhydrazine. It is a clear, colorless, hygroscopic, and flammable liquid with an ammonia-like odor. It is strong, reducing, Its vapor is extremely reactive and undergoes rapid oxidation in air. Example is procarbazine. Sixth example is ethylenimines. It is monofunctional alkylating agent with potential antineoplastic activity. It is reacting with DNA, mainly at guanine and adenine residues. Ethylenimine alkylates DNA, thereby producing DNA interstrand, crosslinks, and DNA breaks, and interfering with DNA replication and cell division. Examples are Fiotepa and ultratamine. For the last example of alkylating agents, I have here platinum analogs. They are a class of drugs used alone or in combination with other medications to treat ovarian cancer, colon or rectal cancer, metastatic testicular tumors, and advanced bladder cancer. Examples for these are cisplatin, carboplatin, and oxaliplatin. For the second classification of antineoplastic drugs, I have here antimetabolites. These are analogs related to normal components of DNA or of coenzymes involved in the synthesis of nucleic acid. It is competitively inhibit the utilization of normal substrate or get them incorporated forming malfunctional macromolecules. It is cell cycle specific and S phase is most sensitive. For the side effects, I have here bone marrow suppression and severe GI toxicity. For the first example of antimetabolites, I have here folic acid and analog. It inhibits DHFR and prevents the formation of tetrahydrofolate and thereby the purine and pyrimidine nucleotides. Folic acid analog is used against a variety of neoplasms. It needs intracellular activation to polyglutamate derivation, which is selectively retained within cancer cells. And the best example is methotrexate. Folic acid analog is used in malignant lymphoma, Sertoli cell tumor, osteosarcoma, and metastatic transmissible venereal tumor. Treatment is administration of leucovorin after high-dose rescues the cells. Second example is pyrimidine analog. Pyrimidine analog has two classifications. First is the 5-fluorouracil. It is converted in the body to a false nucleotide F-dump or the fluorodeoxyuridine monophosphate, which inhibits thymidylate synthesis, which is essential for DNA synthesis and repair. It is used in malignant lymphoma, Sertoli cell tumor, osteosarcoma, and metastatic transmissible venereal tumor. For the second classification of pyrimidine analog, it's the cytarabine or cytosine arabinoside. The triphosphate of cytarabine inhibits DNA polymerase and blocks generation of cytidyllic acid, leading to inhibition of DNA synthesis. For the indication of cytarabine, it might be man, canine, and feline lymphomas, acute leukemia of both lymphoid and non-lymphoid type. For the toxicity, these are leukopenia with megaloblastic changes and GI disturbance. For the final example of antimetabolites, I have here purine antagonists, and the best example is 6-mercaptopurine. It is converted in the body into corresponding monoribonucleotides, which inhibit the conversion of inosine monophosphate to adenine and guanine nucleotides. The side effects are bone marrow suppression and nausea and vomition. The indication of purine antagonists, particularly 6-mercaptopurine, are acute lymphocytic leukemia and granulocytic leukemia. For the third classification of antineoplastic drugs, I have here natural and semi-synthetic products. We all know that plants have been the primary sources of natural product drug discovery, and in the anti-cancer area, plant-derived agents such as BBL and vincristine or VCR are among the most effective cancer Chemotherapeutics currently available. The effective semisynthetic analogs that have been developed include vinorelbine and bendazine, with the most recent being vinflunine, a second-generation bifluorinated analog of vinorelbine. For the first example of natural and semisynthetic products, we have here Vin's alkaloids. These are relatively non-toxic agents and widely used in veterinary medicine in combination with others against lymphoreticulaire neoplasm, carcinomas, sarcomas, transmissible venereal tumors, and CNS tumors. For the administration, it might be through IV or metabolized in the liver or partially excreted and changed in urine. Second example is enzymes, particularly L-asparaginase, which is a G1 phase specific. L-asparaginase breaks asparaginase to aspartic acid and ammonia, thus deprives the malignant cells of asparagine, depleting the non-essential amino acid in the host. Malignant cells cannot synthesize and therefore depends on externally supplied asparagine, leading to cell death. Normal cells synthesize asparagine internally, which is utilized for protein synthesis. Third example is taxanes. It is considered as one of the most important classes of cancer chemotherapeutic drugs in clinical use. The most effective clinical drug on its class are paclitaxel and docetaxel. Fourth classification of antineoplastic agents is hormones and their antagonists. It composed of glucocorticoids, prednisone and prednisolone, dexamethasone, prednisone and prednisolone, and estrogens or diethylstilbestrol and estradiol. Glucocorticoids are cell cycle nonspecific and often used following induction by another agent. Prednisone and prednisolone are lymphoreticulaire neoplasm, mast cells, and brain tumors in combination with other chemotherapeutic agents. Dexamethasone, prednisone, and prednisolone includes leukemia and lymphoma of the CNS. Lastly, estrogen or diethylstilbestrol and estradiol, it blocks effect of androgens in androgen-dependent prostatic tumors, prostatic hyperplasia, perianal glandular neoplasm, and in mammary cancer therapy with other drugs. Life-threatening bone marrow suppression, endoplastic anemia, feminization, and fluid retention are the complications. First example for the hormones and their antagonist is the progestin. It is made of synthetic progesterone and have often been used for hormone therapy in gynecological patients with endometriosis or endometrial cancer. It opposes the effects of hormones in endometrial, prostatic, breast, renal cell, and ovarian carcinoma. Next example is estrogen. It is an antineoplastic nonsteroidal hormonal agent with potent antiestrogenic properties. They bind to estrogen receptors and inhibit the action of estrogen, which stops the growth of certain breast tumors that need estrogen to grow and spread to other parts of the body. Fifth classification is the miscellaneous agent. These are antibiotics which are the only agent available in their class. This means that they are unique in their action and not comparable to other antibiotics, although their spectrum of activity or certain side effects may be similar to other antibiotics. It is used to treat infections caused by susceptible bacteria or other susceptible organisms. For the first example in this agent is the hydroxyurea. It inhibits ribonucleotide reductase, leading to depletion of essential DNA precursors. Cells accumulate in S phase of cell cycle. Next example is L-asparaginase. It is an enzyme derived from Escherichia coli that catalyzes hydrolysis of asparagine. For the last and final classification of antineoplastic agents, we have here biological response modifiers, or also called immunotherapy. It is a type of treatment that mobilizes the body's immune system to fight cancer. The therapy mainly consists of stimulating the immune system to help it do its job more effectively. Tumor vaccines also work to stimulate the body's immune system. And the examples are interferon alpha, interleukin 2, amifostin, and hematopoietic growth factors. And that's all. Thank you.